This video is about OET Reading Part C. Let's discuss why you are still getting it wrong and how to fix it. Most healthcare professionals who struggle with OET Reading Part C, they are not weak in English. They are weak in interpretation under pressure. And that's a very difficult problem and it's too different. You can understand every word in the passage. You can even explain the topic confidently. But when the question asks, what does the writer suggest about? Which statement best reflects the author's view? What can be inferred from? Then you hesitate, right? In that hesitation, you choose the second best option or the answer. So today I'm going to show you why that happens and how to stop it. First, let's be clear about what Part C actually is. Part C is not testing medical knowledge. It's not testing vocabulary range, how much vocabularies you know, whether you can use more flexible vocabularies. No. And it's not even really testing the speed. This is testing whether you can distinguish reporting from endorsement, recognize cautious academic tone, detect limitation language, and separate evidence from opinion. So you have to understand how contrast shifts meaning when it comes to the writers of Part C passages. Okay, they are subtle. They rarely shout their opinion. They position it, and your job is not to understand the topic. Your job here is to understand the positioning. Okay, now let me tell you the real reason why most candidates they fall into the traps. Here is what actually happens. You read a sentence like, recent trials have shown promising short term results. Your brain automatically locks onto promising results positive. Then, 5 lines later, you read, however, the sample size was limited and further longitudinal research is required. But because your brain already labeled the topic as positive, you downplay the limitation. Got it? So examiners know this cognitive bias. They design options that reward careful readers and punish early conclusions. So today we are going to train your reading discipline. Got it? So let's work through an example here. This is a simulated OET reading party passage. If you want, you can just pause the video, try to read by yourself and understand it, and let's see how you're interpreting. Let me read it for you. Over the past decade, wearable cardiac monitoring devices have become increasingly integrated into routine patient care. Proponents argue that these technologies enable early detection of arrhythmias and reduce hospital admissions by allowing real time data transmission to healthcare providers. Several pilot studies have reported improved patient engagement, particularly among individuals managing chronic cardiovascular conditions. Nevertheless, concerns remain regarding data interpretation and overdiagnosis. Some clinicians caution that the continuous flow of patient generated data may lead to unnecessary interventions, particularly when minor irregularities are misclassified as clinically significant. Furthermore, questions surrounding data privacy and patient consent continue to generate debate within regulatory circles. While wearable devices undeniably expand access to monitoring, their long term impact on clinical outcomes remains to be fully evaluated. So, this is the passage. Now, let's move on to the question here. So, the question is, what is the writer's overall view of wearable cardiac monitoring devices? Options are they are likely to replace traditional cardiac monitoring methods in most healthcare settings. They represent a valuable development, although certain limitations must still be addressed. They pose more risk than benefits due to concerns about overdiagnosis and privacy. They have already demonstrated clear long term improvements in cardiovascular outcomes. The four options are given, and now you have to pause, don't rush. Let's think like examiners. Step one. Remember the step one? Identify the dominant tone. Is the passage enthusiastic? Not really. Is it negative? Also, no. Look at the wording carefully. Proponents argue. Several pilot studies have reported so and so, right? while wearable devices undeniably expand access. Long term impact remains to be fully evaluated. So that is balanced academic caution. Writers in OET rarely take extreme positions. They often present progress followed by the limitations. So that balance is your clue here. Now, step two, you have to eliminate the extremes in the options. If you see option A, likely to replace traditional methods, did the passage say that? No, that's an extreme option, right? So there is no language suggesting replacement, no prediction of dominance. So remove the option A. Then option D already demonstrated clear long term improvements. Look again here. Long term impact remains to be fully evaluated. That was given in the passage. So that directly contradicts option D. Then remove option D also. Now we are between option B and option C. This is where most candidates panic. Step 3, compare emotional weight. Now, if you take option C, they pose more risk than benefits. Did the writer say that? The writer mentioned concerns, yes, but did they say risk outweigh the benefits? No. They acknowledged expansion of the access. They acknowledged improvement engagement. They used the terms like undeniably expand. That word undeniably carries positive weight. So C is too negative, which leaves option B. So they represent a valuable development, although certain limitations must still be addressed. Yes, that mirrors the structure of the passage. Benefit, concern, and then cautious conclusion. This is the correct option. Now, if we want to go deeper, why do candidates choose C? Because when they see overdiagnosis, privacy concerns, debate, their brain reacts emotionally to risk related vocabulary. But remember, OET test interpretation, not reaction. So you must weigh the entire passage, not the most dramatic sentence. Now, let's raise the difficulty. Here is a second, more nuanced passage. Let me show that for you. If you want, you can just go through this, read it by yourself, understand, and then we will move on to the question. Okay? Now, here is the question. What can be inferred about MDT meetings from the passage? Options are they are universally regarded as inefficient and resource intensive. Their benefits are recognized, although practical obstacles exist. They primarily serve administrative rather than clinical purposes. Their effectiveness depends entirely on hospital funding levels. Now, again, pause here. This question asks what can be inferred, right? Not what is directly stated. So, here, inference requires you to synthesize. Now look at the paragraph structure again. If you see the paragraph 1, that gives you a strong endorsement. And paragraph 2, acknowledge the drawbacks. And the final sentence, most institutions continue to endorse. That is what given in the final paragraph. So that final sentence matters enormously here. In OET, the last sentence often signals the writer's resting position. Got it? If you see the option A, universally regarded as inefficient, which is false. It says critics argue, not universal opinion. And option C, no suggestions. They are administrative only, right? You can eliminate that. Option D, funding is mentioned indirectly via resources, but not presented as a determining factor if you see the passage, which leaves option B as the correct answer. Benefits recognized, practical obstacles exist. So that matches the tone, structure, and conclusion. Got it? So remember, Part C punishes emotional reading. It rewards controlled reading. And there are three mental rules you must adopt it. The correct answer is usually balance. That is the first one. And the second one, the writer rarely commits to extremes. And the third one, contrast words are more important than technical terms. So if you focus too much on medical terminology, then you tend to miss the tone shift, and the tone shift determine your answers. Got it? So try to incorporate these things when you come for OET reading exam. That's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.